I've given this speech 2 times in the last probably 16 hours, but it's going to be like a TV commercial where I want to say it over and over again, hoping that someone actually hears it, because the soul of education is repetition. And I want to have a very different tone than some of the speeches that have been heard. I want this to be nonpartisan. I want this to be, if you will, a plea for moving beyond our kind of camps we've been in into something that can end the shutdown and actually benefit patients. So, if to open the government, we need to talk about health care, then by golly, let's talk about health care. We have an affordability crisis. Families are being pounded by the cost of everything, including insurance. So how can we make it more affordable? By the way, I'm a doctor. I practiced in a public hospital for the uninsured for 20 years. Many of my patients were middle income, but they could not afford either the insurance or the health care they were receiving. I know the impact this has on a family budget. But if we're going to solve this, we have to put down the ways that we've kind of become entrenched, just like trench warfare. We're going to win. We're going to make them do the white flag. We're going to continue to take our same tired arguments and fight each other until we wear the one down. Well, the people who are casualties, the collateral damage, if you will, are the American people. We need to have creative thinking, but one in which people are willing to move beyond the way they've ordinarily thought. So, the Affordable Care Act attempted to make health care affordable by throwing more money at insurance companies. The enhanced premium tax credit is the latest example. Next year, it'll send, if it's restarted, it'll send $26 billion to insurers to not lower the cost of health care, but to paper over the premium increases that are part of the increased cost of health care. That doesn't make health care cheaper. In fact, if you don't have one of these policies, it could contribute to inflation. And if you're not getting the subsidy and you're buying individual insurance, your policies are definitely higher. This is actually working against the financial interests of many American families. Oh, yes, if you're getting it, it papers over the increase. I would argue, though, there's a better way to do it. Instead of paying insurance companies to manage our money, why don't we trust the American family with a pre-funded federal flexible spending account? Now, first, let me make clear. This is Bill Cassidy speaking. I'm not advocating for the president, although I will note that he now supports this, nor for John Thune. I am the chairman of the Help Committee, and we will be having a hearing soon on these issues. I will make that announcement right now. But I'm not speaking for anyone but myself in a nonpartisan way, trying to convey to colleagues on the other side of the aisle there's another way to get to a solution that gets out of this shutdown and actually lowers costs as opposed to just papers them over. Now, here's the problem. Under the enhanced premium tax credit, not yet. Under the enhanced premium tax credit, it doesn't matter how much health care costs. Because if it costs more, the insurance company just increases the premium and passes that increased premium bill to the federal taxpayer. It actually is almost inflationary. There is no incentive for the provider to keep the cost lower because the cost is just passed on to the subsidy, which is increased to meet the higher costs. Like putting a Band-Aid on a broken bone. You're not fixing the fracture, you're just covering it up so no one can see that fracture. So we're not dealing with health care costs, we're just covering it with higher subsidies. Let's actually fix the fracture. Let's fix the broken bone. And of course, the way to do that is to support the patient, not the insurance company. Now, by the way, insurance companies are important. I'm not going to join the bashing, but I do think it's better if we give the money to the family as opposed to the insurance company. Now, I will say, though, many of my colleagues want the status quo. They're so entrenched in their side that they refuse to discuss alternative ideas that will actually lower cost. And we get all the same old Obamacare debates. People in America right now don't care about those debates. What they want is to make their families' health care more affordable. So the way to do it, let's be creative, let's think differently. Now, please. Imagine a different kind of help. There's a misprint on here, but I'll get to it. Under the enhanced premium tax credit, the money goes to the insurance company. 20% of that money goes for administrative overhead and profit for the insurance company. That should read 80%. 80% goes to health care. What if we do something different? Let's just imagine that we have the creativity and the guts to do something that isn't really different, but is different for this program. Let's establish a pre-funded flexible spending account, taking the money that would go to the insurance company and giving it instead to the family in a pre-funded flexible spending account. 100% of the health care dollar would go towards their care. And we would trust the mother, the wife, occasionally a guy, but women make most of these decisions, to pick her doctor, her dentist, to the best value for her prescription drugs and services. So 100% going to real health care as opposed to only 80% going to real health care. Now you might say this is a radical idea. No, we already do this. I would not be surprised if some of the people up here, my family does, already have a flexible spending account. Now, the flexible spending account takes money that I could have put towards a premium, but instead puts it into this account, and I pay for my services. I already do this, pays for my services. The difference between what I do and what this does is that this would be pre-funded with money that would otherwise be spent on the enhanced premium tax credit. Now, I'm pleased to say that this morning the President posted on Truth Social calling on Congress to redirect subsidies from insurance companies directly to Americans so that they can purchase their own health care. Now, there's a lot of words there, but just start at the top. Donald J. Trump recommending two Senate Republicans, that hundreds of billions of dollars being sent to insurance companies go directly to the people. Why is that important beyond the President's support? A lot of my Democratic colleagues have been saying they don't know that Mike Johnson would bring this up for a vote in the House of Representatives. They want a guarantee that if we pass something on the floor, that Mike Johnson will put it on the floor in the House. I'm from Louisiana. I have a great deal of respect and regard for Mike Johnson. We're good friends. But I do know that if the President controls this concept, supports this concept, that Mike is more likely to put it up on the floor of the House. If what you want is a guarantee to get a vote on the floor of the House, the President's support for this concept makes it more likely that that happens. I thank the President for his support. By the way, I'll also say, after the President spoke to this, after I spoke to this last night, we got immediate criticisms from people saying, oh, you want to give everything that we're giving to the insurance companies to the American people. Not a bad idea, but let's just say, this is not the total premium going to the insurance company. The insurance company still provides the basis for things like car wreck or if you get kidney failure or heart failure. This is that portion that would go to an enhanced premium tax credit and instead would go to the family to make their choices as opposed to the insurance company to make their choice for them. Now, if this still seems too complicated, I'm going to tell you why you can trust in it. 72% of Americans who work for a federal entity or a state government or a local government have this as one of their choices of a health care plan. 47% of people who work for and have an employer, have a commercial employer, 47% of those folks have access to a flexible spending plan. Now, if it was so complicated, why do 72% of government employees and 47% of people in the private sector have access to this plan? It works. We know how to do it. There's established mechanisms. In fact, I have my plan through what is called the Small Business Exchange, an Obamacare exchange through the federal government. I get my FSA through the Small Business Exchange. It is just a little bit to port it over from the Small Business Exchange to the individual exchange to allow an individual to get the same thing. This is so incredibly workable. This is so not complicated that I just kind of scratch my head when people say that it is too complicated. Now, it may take the federal government some time to, it may take them some effort to make sure it can go from one exchange to the other, but we have a president that can make things happen. Just his track record. Operation Warp Speed, some people said it would take 10 years to develop a vaccine for COVID, others at least 18 months. President Trump got it done in 10 to 11 months. President Trump can make the bureaucracy work. If he did it for Operation Warp Speed, he can do for this. We can have this ready for the beginning of next year. And that would be President Trump's effort. There is not a stronger force to get the bureaucracy to do what it should do than President Trump. Now, let's talk about some key differences between enhanced premium tax credits and what I'm calling federally pre-funded flexible savings accounts. Who gets the money? Enhanced premium tax credit, insurance companies get the money. But in the pre-funded flexible spending account, the patient, the family gets the money. What can it be used for? Under the enhanced premium tax credit, insurance premiums. Under the pre-funded flexible spending account, real care. It can be your doctor, your physician, your dentist, your glasses, your prescriptions. By the way, oftentimes these policies don't cover dental work. They don't cover orthodontia. Under this, you can use your flexible spending account to get your teeth cleaned. You can get it. You can use it to have your child's orthodontia work done. Who makes the decision? Here, you go through a pre-authorization process with the insurance company. There, the patient makes a decision for herself and for her family. Does it lower cost? No, there's evidence that the way this works actually drives up premium cost. Here, under the pre-funded flexible spending account, it empowers the patient to shop, driving competition, driving down cost. By the way, if the patient finds that it's cheaper to pay cash with their flexible spending account than to pay the deductible, and that sometimes happens, then she could pay less by paying cash. The point is, if you give the patient the power, good things happen. This pre-funded flexible spending account does not treat the individual as a ward of the state. It treats them like a capable consumer who can decide where to go in a way which is best for they and their family. Now, some ask, won't this cost money? Yeah, about the same as the enhanced premium tax credits for the first year. My Democratic colleagues should like that. An individual, though, would be getting a better value. Instead of, could I have that previous poster up, please? Please. Again, mind the typo, but instead of only 80% of the money going for health care, under the pre-funded flexible spending account, 100% of the money that we're putting up is going to pay for real health care, your dentist, your physician, your prescription drugs, et cetera, 100%, and over here only 80%. And she makes the choice. The choice is not made for her. Now, as I conclude, let me point out a real irony. And I've not wanted this to be partisan at all. I am asking for Democrats and Republicans to come together and find a solution to reopen the government, to pay the people who have been working, and to make sure that those people traveling over Thanksgiving actually have an airport that's open that they can go to. So let's just move beyond our trench line, and let's actually think creatively, and can we give just a little bit to find something which benefits the patient, but may also get us out of this situation? I think the American people are as mad as hell, and they're not going to they're just not going to put up with it anymore. We got to be responsive to that. It's the right thing to do. But let me conclude by pointing out the irony. These enhanced premium tax credits They're a direct result of a workaround to a portion of Obamacare that was not fully implemented. So Democrats are fighting to keep something which is a workaround for something that Republicans formerly objected to. And frankly, Republicans are kind of supporting something that is in line with what Obamacare tried to do. The roles have been flipped. But because one side proposes it, the other side reflexively objects. Let's just stop that. Why don't we just say right now we're actually going to listen as opposed to automatically object because the other side puts it up. So the choice is before us. We can keep on paying insurance companies to hide the cost of the health care, buying confusing bills and rising premiums in a system which actually raises the cost of premiums for some, or we can trust Americans with the tools to pay for their care directly at fair prices with total transparency. If we can, it puts patients first, not insurers. It encourages competition, smart choices, and it begins to make health care truly affordable, not by inflating subsidies, but by unleashing the power of an informed consumer. Now, I'll finish by saying we got to open the government. I mean, I can't even write this legislation unless we have the government open. But you've got this chairman's commitment that we are going to have a hearing in the Help Committee in November on how do we address the issue that is before us right now. And then I will finish by saying, as a physician who used to work in a hospital for the working uninsured, who saw middle-income families that could not afford their insurance and could not afford their health care, I am personally deeply invested in not just reopening the government, but making health care affordable again. And I just ask that my Democratic colleagues not to oppose this idea just because it's a Republican proposing it. And I will say that as a Republican, I will do my best to listen to them. With that, I yield.